What do atypical cells in urine cytology indicate? Imagine your doctor ordering a urine test and finding cells that look a bit unusual. That's what atypical cells in urine cytology mean. These cells are not normal, but they don't automatically mean cancer either. They show that something in the urinary tract has caused changes in the cells lining the bladder or other parts of the urinary system. These changes can happen for many reasons. Sometimes they are due to infections or inflammation, which cause reactive changes in the cells. Other times, they might be related to irritation from procedures or treatments. Urine cytology is a test that looks at cells shed into the urine. It helps doctors spot abnormal cells that could be signs of bladder cancer or other issues. When the report says atypical cells, it means the cells don't look normal but don't clearly show cancerous features. The cells might have irregular nuclei or darker staining, which can raise suspicion. But this finding alone isn't enough to say for sure if cancer is present. It's more of a warning sign that further investigation might be needed. In cases where atypical cells are seen, doctors consider the patient's history, symptoms, and other test results. If someone has a history of bladder cancer or risk factors like smoking, atypical cells might lead to more tests, such as a cystoscopy or biopsy. Sometimes, atypical cells are seen after treatments like BCG therapy, which causes inflammation and can make cells look abnormal temporarily. That's why context is so important in interpreting these results. It's also worth noting that atypical squamous cells, which are a different type of cell, can sometimes be found and may be linked to a higher chance of serious disease. But again, this depends on the overall clinical picture. Most importantly, finding atypical cells doesn't mean cancer is definitely there. It's a sign that doctors need to look more closely. Often, they will recommend additional tests or follow-up to clarify what's going on. The goal is to catch any potential problems early while avoiding unnecessary worry or invasive procedures. If you or someone you know has this result, it's essential to discuss it with a healthcare professional who can interpret it in the context of the full medical picture. Remember, each case is unique, and proper diagnosis depends on many factors.